All right, we're going to get started. Good morning, everyone. My name is John Donadio. I'm the Executive Director of the New Jersey Association of Counties, and I'm going to welcome you to our final in our, I think, a terrific series of virtual workshops. We saved a real critical one for last on labor issues related to the COVID-19 public health crisis, and I am very pleased to have today with us NJAC's Labor Counsel, Joe Hannon from the outstanding law firm of Genova Burns. I rely on Joe, and Joe knows this. I bug him all the time for issues on labor matters and other employment matters. And Joe is just, other than being a terrific guy, most importantly, being a terrific guy, he's just a tremendous lawyer and a tremendous resource and asset for the association and conversely for county governments across the state as well. So Joe, thank you again for all your help and your resource and your friendship over the years, and for taking the time out of what I know is a crazy schedule for you to be here today. Before I officially turn it over to Joe, just a couple of housekeeping matters. The first is, if you have a question throughout the presentation, which should last about an hour, it might go over, they have over the past couple of weeks, please make sure to ask the question in the Q&A icon on the bottom of your screen. And then Joe will try to get to it. If not, I'll jump in and ask Joe the question. And you can certainly email me or Joe after the fact if you have questions that you think of later on. For those of you who are getting your CLE credits, there will be 4, right, Angela, 4 questions that you have to make sure that you write the answers down and respond to those questions accordingly in order to get your credits. And lastly, since this is the last one, I want to again thank Angela Wolf for managing these workshops over the past 7 weeks. She's done an amazing job, did an amazing job with our with the GFOA conference as well, and honestly is the only IT person that I've ever worked with that doesn't give me chest pain. So Angela, thank you again for doing a terrific job. And Joe, with that, I'll turn it over to you, and you can say some of course say some words for Genova Burns, who is also our sponsor. So please thank Mr. Genova, who is also a tremendous friend to the association as well. So Joe, the show is yours.
Thank you, John. And, I appreciate it. I mean, the kind words, if I try to say something about myself, I would probably lessen what you just said. So I'll keep it at there. And yes, it's something that I know our firm, Genova Burns and Angela Genova, pride ourselves in working with John and the county and working through issues. And, you couldn't get a better leader than John. And, so always happy to do this. Sorry that, we don't have the usual conference. It's always a lot of fun, but, I think that, done a great job with organizing this, and I'm happy to be here today to talk about an issue that is constantly changing, to talk about some of these, and let's move into it. Hold on. So talking about some public health, labor issues for county employers, try to deal with a lot of issues today. All these issues, you could spend a ton of time on, but I think the important thing is to kind of almost issue spot, if you will, make sure that you're aware of what's going on, different issues that you should be looking at, potentially dealing with, and kind of have a sort of information of how to handle certain issues, and just make sure that you are, a lot of the stuff I'm talking about today, you probably will have dealt with already or are dealing with them. I want to talk about the safety issues, some current trends and negotiations, because that always matters when you're in a public health situation. So I could talk to you about some of my experiences there. Touch on furloughs, layoffs, subcontracting, just so you understand where the state of the law is there. The leave updates on the various leave laws, the FFCRA, which is right now expiring on December 31 of this year. Some teleworking issues, and there'll be other things sprinkled in there, but that's what we're looking to cover today, and we'll get through as much as we can in the hour, and it's a lot, but so when we're one thing we want to, you want to not lose sight of is the fact that through this crisis that we're dealing with, that we're still dealing with, that has taken up all of 2020 and certainly is going to be part of your 2021 and hopefully not too far beyond that. Hopefully we get out of this as soon as possible and get back to normal. But just remember that there is an obligation to bargain. There is an obligation to negotiate over terms and conditions of employment. This is just the meaning under the Employer-Employee Relations Act. And, it's really there just to remind you of the fact that, you just can't go in and reduce salaries. You just can't go in and unilaterally change, work hours to whatever you see fit. You're still governed by collective negotiations agreement for probably a majority of your employees. And, in dealing with issues that may come up, safety issues, if you're hitting economic issues where you may have to, if you're negotiating a contract, or may want to look to renegotiate or find some creative solutions to solving some short-term problems, and we'll go into some of that stuff. Remember the obligation to bargain, negotiate, and don't lose sight of that, and have the have the communications with your employee representatives. So, your scope of negotiations, this is the general term. I'm not going to spend too much time on it, but just so it's part of the PowerPoint is, there are issues that you have to negotiate, police and fire as permissive, and there are, prohibitive subjects that you can negotiate. And I think what's key in this view is if something speaks definitively on an issue, then you don't have room to negotiate. So things like the FFCRA that came in this year, this is statutory. This gives employees more time, and this is something that has to be provided based on who it should be provided to. So when those things come in, I know it puts more stresses on you as an employer, but these are rights that are granted that have to be followed. Safety. This is something that has been a big concern of employees throughout, and, quite frankly, a very stressful thing of course, stressful for employees to deal with, to come to work or not come to work or what have you. But a very stressful thing for employers to deal with. I mean, I know just by counseling not only county employers, not only, municipal, school board, private employers, but they're all dealing with the same thing about how to make your employees feel as safe as possible in the workplace, and what do you have to do in order to provide a safe workplace. And, you're always required to provide a safe and healthy workplace. I mean, you have POSHA that exists that you're answerable to. That is always, if you're dealing with an issue and that issue creates a safety risk for your public employers, that's always something that's going to make a non-negotiable issue negotiable. So unions, and this is the case. This isn't a COVID issue. If you make a change that and a legitimate safety concern is raised, that's always going to make something negotiable. So that comes up here, and you have to deal with it. So throughout the time, and you may get more of different proposals in dealing with safety issues, and we name a couple here, but indoor, versus outdoor work. How do we deal with this? If you want people to be outdoors, I mean, a lot of the work that is done, office work and stuff, that can't be done outdoors. Ventilation, what's happening with that, when to give individuals breaks. These are all things that you may have unions come to you, and they may have concerns. And I think really in this day and age, what we're dealing with now, better to hear them, better to try to work something out, better to get everybody on the same page so that you're working together. one thing that you have in a lot of collective negotiations agreement, I know I see them in a bunch of ones that I have, is, you have safety committees. Usually they're put in as a way to, you don't want to mandate in your collective negotiations agreement, you have to have X standard. You don't want to say the office has to be 70 degrees at all times. I mean, you want to, you don't want to go too far down the line. So when some of these issues come up, what you get is you come up with safety committees. It allows you to, and if they've been in your contract, they just might not have been used that much, but now this might be a time and a fallback for you to take a look and say, hey, we have the safety committee. Let's meet. Let's go over the issues, and see what we could get. Anything that could be brought up. Now, I think we went through a lot of issues, and now we're at a point where I hope that you've gotten through a lot of the stuff, but the governor did come out with Executive Order 192 literally a week ago, and it applies to all employers, including public, entities. So this applies to you. And if anything, you could look at Executive Order 192. We've had a lot of executive orders to comply with. We all know just by seeing another email from John, who has done a tremendous job updating as, hot off the press with all the executive orders that have come up throughout. This provides almost guideposts as to what you probably should have been doing. But at least it gives you direction of where to go. So I think it's important to really go through that. We have a list of a number of these, and the first one is in no particular order, but just how we have it listed here. The mandatory health screenings. You have to be concerned with how you do it. You have to protect people's privacy. You can't have somebody for a temperature check and they fail it, and the sirens go off and the cameras are focused on that person. Everybody knows you have to be somewhat confidential in how you deal with this. If someone tests positive for COVID, as I think, as you've probably all gone through this, you're not allowed to share that employee's name with people. You are allowed to make people know that you've been a close contact with someone who's tested, but as an employer, you cannot put out that information. But Executive Order 192 does say that you need to It says that we need to let people know, we need to do these checks. It's on us to do it. We have to do the temperature check. We have to do an observance. We have to do daily questionnaires. So, as a result, you're going to want to make sure that you have either a form, an app, something that you have communication from the employee that they're not exhibiting the symptoms, they haven't been in close contact with anybody, within the last 14 days. And obviously you want to do that temperature screening to make sure that you're covering yourself, because you probably should have already, but Executive Order 192 states that. Mandatory mask requirements, people should be wearing masks in the building. Now there's a little rub here, because employees, you could require to wear a mask if they're at their workstation. If they're at their workstation, they're more than 6 feet apart, they don't have to have their mask on. If it's less than 6 feet apart and they're at their workstation, you would need to have a physical barrier to make sure, and then they could take their mask off. So that's in the executive order. The one difference is that in dealing with the individuals who are your employees versus people coming to visitors, is if an employee is saying, I can't wear a mask because I have asthma, I have some kind of health issue, you can require documentation of your employee. The order says you can't require it of a visitor, which gives you some things to think about how to handle those situations. But they don't have to have a documentation that you're in a public building. They don't have to say, well, I have asthma, and you say, well, where's your doctor's note? I don't have it. Put on a mask. You probably have to provide them entity. And social distance to the maximum extent possible. Barriers, masks. We've heard the 6 feet, 15 minutes. It's entrenched in our brain. It's in the executive order. I know we have a poll question, so Angela, I guess you could put that up. I go forward?
Yeah, go ahead, Joe.
Okay,
Thanks.
good. All right, I just want to get this. All right, so we're talking about the barriers. Let me just get to the next screen. Okay. So you want to make sure that you're adhering to that. Social distancing is the most important thing as possible. Listen, you can't be around people 100% of the time, but what you can do is make sure meetings, you're doing them in as big a room as possible with distance. Obviously, to the extent that you don't have to meet in person, that's always advisable at these stages. Limiting people in rooms, restrooms, trying to find some kind of system, one person at a time, signage as best possible, wash your hands, hygiene, limiting people in elevators, just anything where, you want to keep people not together, and certainly not together in a significant period of time that, like I said, we've all been somewhat ingrained with. And I think with the issue with the visitors and, the mask issues is I think it provides a situation of, how often we stay open for, do you do things by appointment? That's why you have barriers and things there, because not everybody might be able to comply with some of these requirements. So you want to make sure that you have them. A very important issue is if an employee's sick, to send them home. Somebody's exhibiting symptoms at the job, you have to send them home, have them get a test. You're not going to know. We don't have the luxury, I think, we don't have the luxury to say this is COVID and this is not. You have the list of symptoms. Obviously, it seems like, I'm no doctor, epidemiologist, whatever, but it seems like certain symptoms are more troubling, but that's not for you to decide. You're not going to know by the sound of the cough. But the fever, the cough, loss of taste of sense and smell. Certainly, but it doesn't matter. Somebody comes to you with a, they have one of the, they're sneezing, they're coughing, runny nose, whatever. I think you have to take that precaution. One of the difficult things is, how do you deal with a situation where an employee does test positive, or you have a notification that they've been a close contact? What do you do in those situations? And, the CDC has guidelines on it, and I think it's important to know them, and I'll try to go through it real quick. But if you test positive for COVID, that you can't come back until you haven't had a fever for 24 hours without the use of fever-reducing medications. Your symptoms must have improved, and you must have gone at least 10 days since first having symptoms. So that's what you're looking for under the CDC as to whether you test positive and come back. We always hear about the 14-day quarantine. The 14-day quarantine applies to those who have been identified as a close contact with someone who has tested positive. So if you're notified that you're a close contact to someone who's tested positive, either through work or otherwise, and you're an employer and you've been advised on that, that person can't come in for 14 days, because in that situation, the presumption is, if that's the term they use, but I'm using it, the presumption is that if you get that test, if you've been exposed and that you would potentially come up with COVID in those 14 days. And if you go past the 14 days and you don't have symptoms, you're not positive, then you are deemed to be clear. So it's important to know those situations and just deal with it. And the problem is when you have in law enforcement, if you have a situation where there's been a lot of exposures, people work together in corrections or what have you, you still have to follow these rules. And there are some different rules in those areas. So what I would say is just stay on top of that as they change. I mean, I think that the law enforcement are a little more open to bringing people back, but just know that there are these standards. The sanitizing, the cleaning, that you got to do as best as possible with those issues. It's they're out there. I mean, they're in the order, and all those things have to be followed, which I'm sure you have already. So, it's a lot there, but you should be preparing to get that all in and be able to comply with what's there.
Hey, Joe, we have
yes.
on that slide, if you don't mind.
Yeah, go back.
Actually, 3 questions that we have. The first is, if an employee has a medical condition that prevents them from wearing a mask, can face shields be an alternative?
Yeah, I mean, I think that goes into with an employee, you have to get the medical documentation, and then you have to make it. You're now going into almost an AD. You're going into an ADA analysis of whether a person could do work with duty of essential function job with a reasonable accommodation. And I would think wearing a face shield, has been utilized. That would be sufficient based on the situation. So, but you'd have to go through that analysis. I mean, but as an employee, you're required to get documentation until you feel comfortable. You get sure that the person, can do that. But I think that would work.
Great. We have 2 more questions, and then we have then we're going to do the second of our polling questions. Okay. So the second question in this series on that slide is, can we mandate an employee to be tested if exhibiting symptoms?
Can you mandate? Well, if somebody's exhibiting symptoms, you definitely have to send them home. And I mean, I think at this point, if they do, I think you can, because now you're looking at the safety of others, and if they've been in close contact with people, then I think they can go get the test. Now the issue is, if you're mandating to get the test, is there going to be, this becomes one of these negotiations issues. Can you, who's going to pay for the tests? You may have negotiability issues with that, but I think it becomes a workplace safety issue, and probably something that that's probably one of the issues you want to deal with the union on, about, listen, this is for your safety, deal with this. This is what we think we should do, that they need to get the test and go with that. But I think you always are on the side of telling them, listen, we're in a pandemic, you're being exposed to people, go get the test.
So Joe, we actually have 3 more questions, but 2 are kind of related, and I've received a number of these questions on really the notice of possible exposure. Okay. Is an employer supposed to advise staff of someone who was in close contact with someone who tested positive, or wait for the employee to have a positive test? It's a good question.
Oh, that a person possibly may have been
Correct.
positive.
Yeah.
The answer is no. You don't have to. It's only after the person has tested positive.
Okay.
Now, listen. I mean, you talk about. So I think that's the legal answer. But you talk about. If the shoe's on the other foot, you understand. But the point is that you don't know until there's a positive, and the legal obligation to notify is once you have a positive, which kind of dovetails into the prior question of,
Right.
if you're sending somebody home, then what are you going to do? I think you need to test.
Right. And this also goes to the notice of possible exposure. What is it? What does this look like? Should a memo be issued to the floor or unit that someone tested positive? Previously, we only contacted direct contacts. So I know there's been a lot of ambiguity, confusion on that particular issue of notice of the possible exposure. So what steps?
I think the best way to do it is this. You have to notify that individual has been in close contact. That has to happen. So that person has to know. I think that you also need to let other people know, in the building, on the floor, what have you, that there was a positive test and that all close contacts have been notified, and that if you have not been notified, other than this email, memo, what have you, then you have not been identified as a close contact. I think that's the best you could do. And that's going to be determination. But I do think that is, the best way to go with it. But it's got to be reasonable. It's got to be limited to, people who are in the building, may use maybe a common elevator, or maybe a common bathroom, things like that, where they actually have some kind of notice. But I do think that's the more prudent thing to do.
All right. Then we have, should we be mandating that civilian employees remain out of the office for 14 days, even if their tests come back negative for COVID? So these are civilian, non-sheriff office, court type of employees, I would imagine.
If they've been identified a close contact, I think if they've been identified, well, let me capture it this way: if they've been identified a close contact, you have to quarantine for 14 days. You could go on day 3 and 4 and get negative tests, but the presumption and the way the CDC has put the guidelines out is you may not test positive in the 3rd or 4th day. You may test positive in the 10th day. That's why the 14-day quarantine is basically mandated.
So Joe, we're going to go into some polling questions. We have 2 additional questions on this matter, but in the essence of time, I'm going to copy these questions down and I'll send them to you, and I'll share the answers with our folks, if that's okay, because I know we're halfway through, and I know we're not halfway through yet.
Yeah, and that's fine. And listen, I mean, this is part of the practice. So,
Yeah.
some of these things, they're ongoing. They,
Right.
they keep changing. So yeah, but I'd be happy to look at them afterwards, because
Great.
all right.
Thank you, Joe. So Angela, here we go.
Good.
All good, Joe. Thanks.
All right. And listen, those are all very important things and sensitive issues to deal with. So So I appreciate the question. They're all really good questions. They're really the right questions. So let me go a little bit into, what, because there's a whole lot of different ways to deal with this, and so many different tentacles to this, if you will, as to how this affects. And one of the most important things that, probably more important, I'm not saying it's not important, but more important than where you have your alcohol disinfectants in the building is, the effects of COVID, how you're dealing with it in negotiations, and, what are some things that you may have to look at. One of the things you may need to look at is, because we're in a pandemic, is health insurance and what's happening, what are your levels and what's going to go on, because during this crisis, you're still dealing with Chapter 78, trying to get some relief in health insurance. So, in looking at it and reviewing it, just to review the basics, your selection of carrier is non-negotiable. You could choose every one you want, all right, but then the level of benefits are negotiable. So, and these benefit levels include everything. It includes co-pays, deductibles, out-of-pocket, prescription, your out-of-network cost, your provider network, what doctors, hospitals, all that stuff becomes your benefit levels. The question becomes, how is your contract language written? Do you have equal to or better than benefits, which makes it very tough to change. You almost have to have everything the same. Or, is it substantially similar? And then it gives you a little more of a balancing test. So, you're always going to want to look at that. Have it here. These are just kind of all the different issues that you're going to look at in negotiating health benefits, reduced contributions, post Chapter 78, and that's something to be careful of during these times, because Chapter 78 contributions are negotiable. There is, just for a footnote, or I think it's more than a footnote, is a recent case that came out, Little Egg Harbor, in September, was the first interest arbitration case in New Jersey where the arbitrator issued Chapter 78 relief. And, that's significant because now, we can no longer, write in our post-interest arb briefs or go into negotiations and say no arbitrator has provided Chapter 70 relief. It's happened. Now, you got to look at that case a little more. There were zeros involved. So there were significant givebacks to get that, or at least to award it. And you got to balance that, that issue as far as, how with that, and, what does that mean? Because you may be, reopening or addressing negotiations. And, I think a few things that are say, because some of you may be going in negotiations, and negotiations during this time is very different than, okay. First of all, what are you doing with term? All right. Term, usually looking at 3 or 4 year deals. You want to get some financial stability. You want to know where you're going to be so you could budget better, and some long-term certainty is always a good thing, and it allows you to plan better. But you're now dealing with a 2020 where you've probably seen increased revenues, 2021 where you're probably going to see more decreased revenues and not know what happened, and and you don't know when it end. So, will the economy recover next year at some point? Will it take 5 years, 10 years? I'm not an economist. I can't say it. But I think it's opening the door to some shorter term deals. And it's something about, I still think you were seeing, pre-pandemic, settlements still in the twos, but maybe with increment. So it was raising a bit more. I think you saw your interest arbitration awards were out with 2+ increment. But that was holding the line on Chapter 8. Now that's, now we see there might be some inroads there. These are just important things to think about. I mean, I just went through an interest arbitration, waiting on a decision, but it's just different in these days, just the way you handle it, doing it on Zoom or what have you. So I think it's, if you get a good deal, you get a good deal. But, I think kind of keeping the terms low when you can is something that, typically wouldn't go in and say, hey, let's do a 1-year status quo. But it might be the best to not box yourself in while you have some uncertainty, not have to go to the furloughs, the layoffs, what have you. So, that's important. The A3971 with the bonding, that, that's another available source. I'm not going to go too far into that because I want to cover other things, and, time's creeping away. Financial exigencies. I think the important thing with that is just to know that you can't just tear up a contract. You don't have that right to do it. If you're dealing with difficult times and you want to make adjustments, you have tools that are available, and we'll go through some of them. And, you can reopen a contract. Typically, I don't like to reopen a contract because the contract is the time, but you may want to look into that. But you just can't, repudiate terms. I mean, the contract has to hold. So, these are, I've already talked about that. You can negotiate give back, sidebars, alternative options. But one thing you can do is look to, furloughs, layoffs, and subcontracting. Typically, you don't want to go there, and that's why you would look to negotiate some alternatives, because that is a way to stave off these issues. But as you see, the first bullet point there is the decision to lay off staff is a managerial prerogative. That's the layoff. I'm not talking about furloughs, but layoffs, you have a managerial prerogative to do it. There's some things you have to negotiate based on a procedure. If you're civil service, you have to look at some alternative options, or at least explore alternative options. Doesn't mean you have to do them, but they're in there. And, it's one of the things that, it's almost a reminder of, hey, you might want to look to do things. So it includes looking at other ways to save money, hiring, promotional freezes. Are these things that are going to, it might be the first step you have. A lot of places go to, automatic hiring freeze. And this way you're not expending new monies, and you're trying to, hold the line there. Discussions with impacted unions. You want to sit down with, with unions and advise what's happening, and try to seek alternatives. If you're a non-civil service jurisdiction, then you're not governed by the civil service rules. You're going to be governed by whatever your CPA says, whatever your, handbooks or ordinance says. And then you have less, administrative red tape that than you would have with civil service. The decision to subcontract is a managerial prerogative. A lot of stuff you're doing, it's tough to subcontract, but there are things that could happen. You can decide to subcontract services, and that's permissible. But you're going to subcontract the whole thing. You want to be careful. There's a unit work rule. You can't just have people still doing work in the union and just send it out to another unit to work. So you have to be careful with that. There are furloughs, but the furloughs are they are a way to save costs. They are a way to not have to lay off staff, and to deal with these issues, especially when you're looking at teleworking. Or do people have enough work to handle the time off? You have to ask employees to participate. You have to come up with a plan, but it has to be voluntary participation. And just so you understand the law on that, and understand that you just can't go out and do a voluntary furlough, is, going back to when we had the last economic crisis back in 2007, there were, emergency regulations that were put out there. And as a result, employers were able to basically unilaterally do furloughs, and that was upheld in Keyport. But after the regulations passed, you had the Robbinsville decision, in which a public employer looked to they looked to impose voluntary not voluntary furloughs, involuntary furloughs, to deal with an economic crisis and save money and prevent the need for layoff or something more drastic. But the point was that this has to be negotiated. You just can't unilaterally do it, and that's the world that we're dealing with now. So, a lot of times you could say, well, hey, furloughs is a much kinder way of dealing with it. We sacrifice 5-10 days here and there to save money and deal with it, but just know that it's an option, but you're going to have to negotiate that with your unions. You just can't snap your fingers on it. So the hope is, and I hope you haven't been there, that you don't want to be in a situation where you have to lay off staff. No one wants to be there, but listen, it is one of the tools at your disposal, and we see where numbers are. They kind of going, they kind of shot up. They kind of went back down again, just over the country with unemployment. I'm hoping that we don't have what looks to be a potential bad winter where this is going to get worse again. I'm not saying just in county government, I'm saying nationwide, and that creates issues there. But just know where it stands on that.
Hey, Joe.
Yeah.
We have, if you don't mind, we have a couple of questions. And again, if we don't get to all of the questions, email them to me, and we'll get them to Joe, and we'll make sure we'll respond accordingly. And this recording of this session will be available on NJAC's website later today. And Joe and I will talk about the PowerPoint presentation. We may make that available as well, as long as it's okay.
That's fine. Yep.
With Joe. So we'll share that with you. So I just have a couple of questions, Joe. We have a number of questions. I'm going to try to get to all of them. Could you clarify the difference between employees who must remain symptom-free for 10 days versus a 14-day quarantine?
Okay. Yeah. If that is the difference between the symptom-free for 10 days is one of the factors that you use for someone who's had a positive COVID test. The quarantine is for those, the 14-day quarantine are for those who are, who have been deemed a close contact but haven't tested positive. The point is, you don't know when these close contacts are going to eventually test positive, because I think the way it is you could test positive 2 days later, you could test positive 12 days later. So you have to have that 14-day buffer. Once you have it, you tested positive, then that 10-day symptom-free, no fever for 24 hours without fever-reducing medication, symptoms have improved. That is where the CDC is saying if you meet those standards, you are, if not recovered, you're no longer contagious. So that's kind of the distinction.
Okay, this one is, this is employees who are on leave of absence that is not COVID related. Can the employer terminate their health benefits? Or should the county leave the employee active due to the pandemic and recoup copays at a later date?
Trying to digest all that, John. If it's not, well, let me try to break it down. If it's not COVID related, then you're not dealing with FFCRA, you're dealing with basically what I would understand regular FMLA. You're dealing with just typical leave law as it exists. So I don't think that anybody would get what I would say a sympathy benefit because we're just going for it. I would handle that the way you would handle any absence, any non-COVID absence. Of course, every absence was a non-COVID absence before COVID hit. So, getting back, so I think that's the general premise. And then if you're talking about that particular question, I think you then have to follow the law at that point. If they're out of, I mean, there's a lot of facts that go into it, but if they're out of time, they've exhausted all their leave time, and they no longer have time and they can't return to work, then I think you're probably dealing with COBRA, things like that, unless I'm missing something there. There's a lot there, but I think that the point is, if it's not COVID related, then they don't get the benefit of any COVID laws because you have to meet the criteria.
Right. Great. Thank you, Joe. One more, and then we have our polling question, and then we'll get right back into it. And this is a general question, Joe. At what point would a long-standing past practice be considered something that is acceptable, which is not included in the contract or collective bargaining agreement?
Yeah, listen. That's a question that is answered, that has been asked forever, and it's a great question, and it comes into play anytime you're dealing with a contractual issue, and certainly now as well. The answer to that is, if you don't have the factors for past practice, is you have ambiguous contract language or that doesn't speak to it. And the practice has been readily known by the parties over time and has been clear over time. So I think the point is, I can't give you a bright line answer, but I think the main thing is that if you have a contract that's silent and you've been dealing with something consistently since its inception, or certainly consistently for a number of years or a number of circumstances, it's going to be tough. I think that'll become a practice. I think if you go back and forth, or the practice is not clear, it has been dealt with inconsistently, then you don't have a past practice. So, so it is one of these, and I know people don't like hearing the answer. It is going to be one of these depends, but that's the standard. So I think you just have to really take a look at your facts and know how a situation has been dealt with, because a past practice could be established over a year if you started dealing with an issue and you've just had consistently dealing with the same way, or if somebody's arguing practice for 10 years but you've gone back and forth, then you don't have a practice. Obviously that's the general answer. If you have more specific facts, you could probably deal with each issue, but usually those cases end up having an arbitrator decide who's right.
Okay, Joe, I think we're good. We have one more polling question. That was our third one, so make sure you
Good to go.
that.
All right.
Thanks,
I'm
Joe.
going to spend the remaining time on FFCRA stuff, because I know that's a big deal and that's new. So let me spend at least a few minutes on that. You'll have the rest of the slides, and like John said, to the extent there's any questions. But the Family First Coronavirus Response Act was passed this year, and it currently expires at the end of this calendar year. So you have a situation where you don't have, we'll see what happens, in the next 2 months as to what happens with this. You should have a policy about its use, and there's two components of it. It's emergency paid sick leave, which was definitely one of the polling questions before, and an emergency paid family leave to it. So, what this does is you must give up to 80 hours of sick leave to an employee who cannot work or telework for any of these reasons. And you see them, you're probably familiar with them, but if the employee is subject to COVID-related quarantine or isolation order, the employee is told by a healthcare professional self-quarantine because of COVID, or the employee is COVID symptomatic and seeking medical diagnosis. In these situations, these are reasons 1 and 2, 3, they entitle the employee to 100% of the paid sick rate, which is capped at $511 per day, or you see the amount total. If you're in a situation where you're caring for someone due to an isolation, the school closed, or the employee is experiencing any other substantially similar condition specified by DHS, then you're in a situation where it's a reduced paid sick leave rate. and it's capped at $200 a day, but that provides the paid leave for individuals. So that's something that is still applicable if employees haven't utilized that time yet. This is still there at least through the end of this calendar year. Okay. So the emergency paid sick leave, there's no waiting period for it. Now teleworking, there's a whole lot we go into that, but just understand, that's your decision to make whether telework, would happen. It's for you to decide, what positions can telework and what can't. I would just say to proceed with caution. What do I mean by proceed with caution there? Understand, the safety rules we were talking about, Executive Order 192, the things that have to happen there is, you want to make sure that if you are bringing people into the office, you're handling that, because you can't just say, well, we want everybody in, it's our decision. It is your decision, but you don't want to walk yourself into a situation where you're providing then an unsafe working condition, and you have to deal with violating anything with that. It may exempt first responders from entitlement. FMLA rights may overlap here, and you may not require the use of leave banks first. So you can't just, this is something, and it goes to the no waiting period. If people are entitled to their emergency paid sick leave, should they use it? So you can't say, well, listen, you have, 30 sick days, use them first, then we'll deal with this. This is their right. They have the ability to utilize it. What the FFCRA also did is it expanded FMLA rights for employees. So you could still use FMLA for your own illness or to care for a sick family member, and expanded FMLA to create a paid leave entitlement for child care purposes. So, and here you must only have been employed for 30 days. So the old rules of you need to have X amount of hours. This comes to people who have been employed right away. The school or place of care is closed, you're unable to work or telework, and you have 2/3 pay capped at $200 a day, and you get a maximum of $12,000 for a 12-week period. So really, the expanded FMLA rights, the emergency paid sick leave rights, they're interconnected. You have to review them. There's also expanded New Jersey Family Leave Act entitlements, which extends family leave for places where you're dealing with a child whose place of care has been closed by a public official. So basically, it's taking the NJFLA and just expanding it to situations that are part of what we're experiencing with COVID. So you have to look at those requirements. A word on the teleworking. I'm not sure. I'm sure probably all of you are doing some kind of telework, and you have the right to create a policy. You should be just discussing this stuff with unions where appropriate. I mean, the one thing I would just say is that you're clear as to who's being able to use telework. You're clear as to what's expected of individuals when they're teleworking, because you want to make sure that you're keeping your time free. I know a big concern is people are home teleworking, they're not really working a full day, and that's a legitimate concern. The other thing the flip side though, is you want to make sure that the day is being limited to the day. So if a person's working a 9 to 5 day, you want to be clear you're working 9 to 5, and that any work for anything beyond those times, you have policies in place. You probably should have them in place already, but that they are, but if not, have a mechanism in place so that there is approval should they be working, beyond those hours. Because what you don't want to have happen is, create unnecessary over situations. I would think teleworking, there's plenty of time between the work day to get work done. You don't want to be sending people assignments at 6 o'clock at night, asking for it. Now you're creating an overtime issue. Think about that. Make sure that, you don't want to be hit unexpectedly later on with somebody saying, well, I had all these assignments and I had to work overtime, and you didn't have the appropriate mechanisms in place to deal with it. So I think you want to make sure with that. And a last thing to that, and then I'll end there. I have some slides on teleworking and stuff, and you'll see them, but I want to hit some of the big parts on that. Is, the issue of hazard pay has come up, and how to deal with that, because I've gotten that with the law enforcement units and the people coming to work every day that, we're coming to work and other people are staying home. We deserve some benefit to that. And, that's something you have to think about. But in a difficult time, when you're worried about, decreased revenues and everything else, that's a little tough to do. It's an economic benefit. And certainly there's no requirement in the FLSA or New Jersey wage and hour law for hazard pay. But if somebody comes to it and it's something that you want to consider, I mean, do what you want to do, but understand that that's negotiable, and that's something extra that you would provide. But I know that, a lot of law enforcement officers have brought it up. Listen, they have a greater sense of exposure, corrections officers, what have you. And, I think we're all sympathetic to that. But it becomes an issue of, limited resources in a time where, you don't know what the next day is going to bring. So listen, there's always a ton of things to talk about. I tried to hit, what I feel is, some of the most important stuff and dealing with some of these sensitive issues, which from your questions, I think it shows that you're on top of it and doing the right thing. This is not an easy time. Things continue to change, although they've been a little steady for a while. So, the important thing is to stay up on top of it. Communicate with unions, but communicate with the people in charge that you have. Your administrators, your counsel, just to make sure that, you're handling things appropriately, because, at the end of the day, everybody has the same goal. Everybody wants to stay safe. Everybody want to keep their fellow employees safe. And if you're guided by that general philosophy, you're going to handle most of this stuff, pretty well. And I think it has. I think that at first was a lot of panic. I think employers are handling it well, but certainly, there shouldn't be a day where you're not asking questions about this, because that's just where we're at now. So, John, I don't know if there's anything else, but I know that we're kind of at the end.
Yeah, Joe, we do have two questions, and then we still need to do our polling questions. So the first of the two questions is an employee also eligible for 12 weeks of FFCRA, or as my friend Grace Kelly in Hunterdon County says, FERCA, if their child's school is closed after taking a 12-week leave for themselves?
They get you get 12 weeks. It's not an additional 12 weeks. It's just it's 12 weeks that you could use for you could use that 12 weeks for different purposes.
So it's not 12 weeks.
It's not 24 weeks.
It's not 24. It's 12 period for whatever of the two reasons that they mentioned.
Yes.
Okay. And then lastly, it looks like, does an employer have to grant leave if the employee's child's school is open and the parent does not want to send the child to school? So the employee insists on teleworking for the unknown duration. So again, if there's a school that, you have the option to, go to school in person, but the parent is choosing, and I know this is the case in a lot of circumstances, the parent is choosing to keep their child home.
I don't believe that the law provides that leave. I don't believe the law provides for that leave. I think they talk about being closed. I don't think it talks about a discomfort level. I mean, that's a trickier one, and I'm trying not to punt on these answers because they're good questions. That's something that before I would say just deny them and and to hell with it. I probably would want to analyze that one a little more. and I'd be happy to share. But my initial reaction is that is not part of the reasons for leave under the FFCRA.
Okay. All right, great. I think we have, Angela, one more polling question, and we'll make sure to leave that up so everyone answers. If you didn't get a chance to answer the question number 3, I wrote your name down, and we'll make sure that we, we'll make sure you get your credit. All right, great. It doesn't look like we have any more questions. There were plenty of them. Again, if you have any follow-up questions, or if I missed asking Joe your question, please send it to my email and I'll get it to Joe and we'll get back to you in short order. I want to once again thank you, Joe, for really an outstanding presentation again that we'll make available, both the PowerPoint presentation and a recording of the entire presentation on NJAC's website. And also want to thank Angela again for having these past 7 weeks run very smoothly, and appreciate certainly all the participants. So thank you, have a great day, and hopefully we'll see you in May at NJAC's annual in-person conference.
Amen. Thanks. Happy Thanksgiving, everyone.
All right, you too. Thanks, Joe.